And then, folks, if you don't understand HSA, do some homework, Google it, research it. But you can go to Bank of America, you can go to Fidelity. And HSA, you get to manage and invest that money. You could buy a money market, you know, keep it in cash, a high yield savings account, but you could buy the S&P 500. You could put the money in the stock market.
When you need some advice, never sacrifice, always get it right. Ask the Planman. Finance, insurance, and more.
All right. Happy New Year, Allie. Welcome, welcome, welcome. Allie's first time back on the show. We are live here on Facebook and LinkedIn. I'm Bruce Weinstein, your host. This is Ask the Planman. We're going to do a quick episode today. Allie's going to come on. We're talking about, you know, open enrollment season just is winding down, Allie, for health insurance. Medicare ended in December. And then certain states in the country like New York and New Jersey run through the 31st. Today's January 28th. And so you still have last minute changes and options to make for your open enrollment. And what I'm finding in talking with our clients this season is they're unaware of a program that we have now available in 49 of the 50 states. Everybody but the state of Washington can have access to this. And it's a private health insurance plan. It's not on the marketplace per se, but it is compliant, meaning it's ACA compliant. It provides all your preventative care. All your MEC services are included at no charge. So it looks like, smells like, and acts like a marketplace plan. However, it's a private plan. You have to get through a small hurdle of questions of some pre-existing conditions, which has always been the problem of finding affordable health insurance and why the marketplace exists for those that do have severe knockout pre-existing type questions. But we've been using this plan now for a few months, and we wanted to share a little bit more about it. It's got HSA options. We've had episodes, Allie, you and I have done on health spending accounts, and these have health spending account options. And I want to dive into that for a minute or two to explain and help people understand why would they want that. If you're in a high tax bracket, if you're going through a fair amount, 1,000, 2,000, 5,000 of medical expenses every year, most of us are paying for that in after-tax dollars. You got to make a buck. You got to pay your taxes, 30 to 40%, and you're spending 60 cents on a dollar. And HSA allows you to contribute over $4,000 for one person. It's like $4,300. If you're over the age of 55, you get $1,000 catch-up. Now you're at $5,300. A family, I think it's $8,300 or $8,600. So we can do a quick Google on that. But so you could put away $9,000 plus dollars pre-tax, means it's tax deductible. So you're getting a $9,000 write-off at a 30 or 40% tax bracket, depending on where you live. And now you're paying for your medical expenses, your co-pays, your deductible, your over-the-counter medications, tissues, things that you go to CVS and Walgreens for, and you swipe your HSA card. It's going to be approved, and you're going to pay in pre-tax dollars. And that could be a 50 to 100% swing in what you're spending. So we've got two options on this program that are HSA. The other two options are copay plans. Very strong with copays, deductible around $3,500, max out of pocket around $7,000. Again, depending on which plan you're picking, they're very strong. And it even has something called an indemnity plan, kind of like a mini AFLAC. So certain services are going to rebate you and reimburse you for certain things as well. So that's an added feature built into this program. And Allie, let me tell you, my friend Randy is out in Westchester, right, Randy? Randy and his family, wife and two daughters, we saved them $1,600 a month on their plan living in New York. And they haven't really had other options available. So I'm robustly trying to get this messaging out. If you're in New York, New Jersey, Connecticut, Pennsylvania, the Northeast, Massachusetts, Colorado, California, you've been very limited on your options when it comes to health insurance. Now, we've done a lot in the short-term medical world. We've had episodes on that as well. This is not a short-term medical plan. As I said, this is full-blown ACA compliant. It's something everybody needs to take a look at. Now, it's not age-based. So it's probably more ideal for somebody in their mid to late 40s and above, because for me at my age, a health insurance plan is going to run around $1,100 to $1,200. I can go on this plan between $600 and $850. So that's a $300 to $400 a month savings for an individual. A family plan, you can get in between $1,300 and $2,100. So in Randy's case, he got a family plan. He was spending over $3,700 a month. A month, folks. That's a lot of cabbage. Now, what also works in this particular case, another feature is Randy's kids are in college and they're out of state. And so a lot of the schools will offer or encourage or even mandate you have to buy your kids health insurance while they're on campus because they're out of market, they're out of state. This plan works in all but one state, the state of Washington. It's not actually not available. It probably works, but it's just not available for somebody in Washington to purchase yet. We're hoping that it'll get there. But if Randy's kid's in North Carolina, this network is available. Doctor lookups are there. They can go to urgent care. Obviously, God forbid, a hospital or something more dire. But again, if you're a parent with kids out of state or even in state and you're being forced to, I'm in South Florida. And so most marketplace plans are going to be local to where I am, Palm Beach County. So if you're up in your area in Tallahassee, somebody's going to Florida State, that's going to be out of network on a marketplace plan. They're not really going to get a lot of coverage. So we have clients that are down here that pay for private school-based or school-provided coverage. So when they're at U of F or Florida State or wherever they are, they can be covered. So now this plan can help reduce that. So now think about what they're saving in that regard. So this is something, Allie, that we want to make sure people understand. Now we're going to do a second episode a little bit later on. We're going to talk about the differences of HMO versus PPO. And this particular plan we're referring to is straight PPO, which is what everybody wants. And we're going to talk more about that. But we just did a client in Florida last week, cut them in half. They were in a Florida-based marketplace plan, PPO, $2,700 a month, cut it in half, $1,340. And they went with the HSA option. So now they get to pump over I don't think they're over 55, but $8,000 plus that they could put into a pre-tax account. So now they get a write-off, just say 30%. They pick up a $2,500 tax savings and they get to fund the HSA. And then, folks, if you don't understand HSA, do some homework, Google it, research it. But you can go to Bank of America, you can go to Fidelity. And HSA, you get to manage and invest that money. You could buy a money market, keep it in cash, a high yield savings account, but you could buy the S&P 500. You could put the money in the stock market. It's not use it or lose it money. It rolls over and it stays in there in perpetuity anytime you need it later on. So for a younger clientele, somebody's in their 30s, 40s, 50s, that money can sit in there and grow exponentially for the next 25, 30 years until who knows when. And then it's transferable. They can, leave it to their heirs if they don't use it. It's like a Roth. It's like a version of a Roth, except it's for health expenses. The Roth is deferred. The Roth can be transferable to heirs. The Roth is just not a pre-tax contribution. So this is very dynamic for people out there. And by the way, Allie, being January, we've got the data for last year's stock market. The S&P made 25% in 2024. So you're going to put $8,000 away this time last year, set up your HSA, have $8,000 in there and make 25% on your money. That's another $2,000. Oh, and did we mention, Allie, they don't pay tax on that. So it's tax-free, compounded 10, 20, 30, 40 years, depending on how old somebody is and how long it sits there. And then when they need the service, swipe the card. Comes out of the account. And they can spend down, you cover their deductible, cover their copays that way. So, folks, if you want to know more about this plan, you can get on this plan year round. If you're self-employed, if you're a small business owner, if you're an entrepreneur, if you're a professional accountant, an attorney, somebody, you're just working for yourself. Allie and her husband work for themselves, right? They have their own businesses. So if you're a solopreneur, an entrepreneur, you don't have employees per se, you need to understand and know you have some other options in there. If you're not getting subsidies that are available on the marketplace, this is something that we are knocking the socks off for people who are, in my opinion, overpaying for those kind of programs. So they can hit me up, Allie, at 844-PLANMAN. That's our phone number here. You can give me an email, give us a shout out. But Allie, any questions, anything I didn't cover you want to make sure we got out today? Allie's got a little laryngitis, everybody. Allie.
No, we're good to go.
I think I hit all the bullet points on there, folks. So listen, if you're looking for a PPO with national coverage, fairly low deductibles, want to check your premiums and your prices against what you're paying now on your current plans. Yes, you can switch. Just because you were just enrolled on a plan for 2025 doesn't mean you can't switch. This plan's available 365. It's available the first of every month. There's a deadline to enroll. So, we can get you on for March, April, May, June, July, whatever it is. If you're in 49 of the 50 states, this plan's available to you. So let us know if we can help. No cost, no obligation. Happy to price it out. Happy to explain it to anybody who's out there. Give me a call, 844-PLANMAN. And Allie, remember, what's the phrase? When you need some advice, always get it right. Come ask the Plan Man. Thanks for seeing me live today, everybody. We'll talk to you soon. And happy almost February.
When